Natural remedies for erectile dysfunction, myths and facts. Search on YouTube for herbal remedies for erectile dysfunction. Try it now. Go to YouTube, search, and type herbal remedies for erectile dysfunction. You'll find hundreds of videos in Arabic and other languages. These videos or channels often suggest remedies like pomegranate, garlic, ginger, or other herbal recipes that seem endless. But the question remains, are herbal remedies truly effective for erectile dysfunction? To answer this question, we first need to distinguish between alternative medicine, herbal remedies, or other forms of non-pharmaceutical treatments. Treatments for erectile dysfunction using alternative medicine or herbs do exist. However, one must differentiate between remedies that have been scientifically studied and those that have not. As I mentioned at the beginning of the video, could ginger help? I don't know. Could garlic help? Maybe. Could certain foods help? It's very possible. Could pomegranate help? Perhaps. But the real question is whether these remedies have undergone proper scientific studies to confirm their effectiveness in treating erectile dysfunction. Let's break this down. There are remedies that have been studied in reputable universities, providing clear results. How are these studies conducted? Researchers recruit two groups of people, say 20 individuals, all with similar levels of erectile dysfunction and chronic conditions like diabetes or hypertension. They divide them into two groups. One takes the herb being tested, while the other takes a placebo, a fake or dummy treatment. Why? Because psychological factors are significant. For instance, if a patient visits my clinic and I give them any pill, telling them it's highly effective for erectile dysfunction, they might improve, even if the pill has no real benefit. To eliminate psychological effects, they give a placebo, and then observe whether the group taking the actual herb shows real improvement. This is what I mean by herbs that have been studied and proven effective for certain cases of erectile dysfunction. One such herb is ginseng. Ginseng is a Korean herb that has been used for centuries. In 2008, a British university conducted a study on its effects and found that ginseng could indeed increase sexual desire. This boost in desire can improve mild cases of erectile dysfunction. It has no significant side effects except for causing insomnia in some individuals. It doesn't directly affect the heart, blood pressure, or other conditions. You can find ginseng capsules in most pharmacies, but they need to be used consistently for at least a month to see results. Another herb is horny goatweed, also known as epimedium. This Chinese herb has been used for ages. While studies have not been conducted on humans, animal studies suggest it increases testosterone levels, potentially improving erectile dysfunction. However, people with heart problems or high blood pressure should consult a doctor before using it. The third herb is maca, one of the most commonly mentioned herbs in herbal capsules for erectile dysfunction. While it has undergone studies, the exact mechanism of how maca improves erectile dysfunction remains unclear. Still, it is beneficial for mild erectile dysfunction but is not recommended for people with high blood pressure. The fourth herb is ginkgo biloba, commonly found in many supplements. Ginkgo improves blood flow to the penis, and studies on 60 individuals showed that 40% experienced improvement in their condition after a month of use. However, it should be avoided by people taking blood thinners like aspirin or Plavix. In general, herbal remedies are most effective for mild erectile dysfunction. They are not as effective for moderate or severe cases. People with heart issues or high blood pressure should consult their doctor before using these remedies, as herbs also have side effects. For example, some patients used honey sachets marketed as natural and safe for erectile dysfunction. These sachets were later found to contain crushed pharmaceutical ingredients like Viagra or Cialis, which posed risks for people with heart problems. In conclusion, whether it's herbs, food, or non-pharmaceutical products, always consult your doctor before use to avoid complications. Stay safe, and best wishes.